Edutainment Studios welcomes you to Overactive Bladder, Helping with Relief. This module is part 3 of a 3-part series on the overactive bladder. An overactive bladder causes a sudden urge to urinate. The urge may be difficult to stop, and overactive bladder may lead to the involuntary loss of urine. If you have an overactive bladder, you may feel embarrassed, isolate yourself, or limit your work and social life. The good news is that a brief evaluation can determine whether there is a specific cause for your overactive bladder symptoms. Management of overactive bladder often begins with behavioral strategies such as fluid schedules, timed voiding, and bladder holding techniques using your pelvic floor. If these initial efforts do not help enough with your overactive bladder symptoms, medications are available. In this course, the objective is to help you learn some things that can be done to help patients cope with having an overactive bladder. Small changes in your daily life can make a big difference to your health. You can try these following tips. You can try to lose extra weight. Being overweight puts more pressure on your bladder and weakens your pelvic muscles. This can cause or worsen leaks. You can try going to the bathroom often. Not emptying your bladder enough can lead to leaks. You can quit smoking. Smoking can irritate your bladder, and constant coughing can stress the muscles that hold back urine. You can try drinking the right amount of fluids. Drinking too much liquid makes you urinate more often, but drinking too little makes your urine too concentrated, which can irritate your bladder. It also can lead to constipation, which can make bladder symptoms worse. You can try to avoid food and drink triggers. Certain foods and drinks can irritate your bladder and cause you to urinate more often. Find out which foods trigger your leaks and then take steps to avoid them. Your first reaction may be to drink less to reduce your need to urinate, but this is not always the best choice because it can make your urine too concentrated. What you drink and when is just as important as how much you drink. Instead of just cutting back on fluids, try to space out your drinks throughout the day. Do not forget about fiber. Constipation causes you to strain during bowel movements. This puts pressure on your pelvic muscles and can lead to leaks. Keep your bowels moving smoothly by getting 21 to 38 grams of fiber a day. Read food labels to find out how much fiber you are eating. Fruits, vegetables, and whole grains usually have high amounts of fiber. Regular exercise also helps your bowels work properly by strengthening the muscles in your intestines. If you have tried to change your diet and exercise habits and still have trouble with constipation, talk to your doctor. Please feel free to investigate these other sites for more information, and remember to bring any concerns or questions in to discuss with your doctor. Thank you for joining us today for part 3 of this 3-part series on the overactive bladder.